What if a single cyber attack could shut down a hospital and expose thousands of patient records? In 2026, healthcare remains one of the most targeted industries for cybercrime. Ransomware, phishing emails, and data breaches are putting both patient privacy and medical services at risk. The good news? Strong cybersecurity doesn't require a massive budget. Simple steps like multi-factor authentication, secure backups, employee training, and strict access controls can dramatically reduce risk. Protecting patient data isn't just an IT responsibility, it's essential for every healthcare organization. Better cybersecurity means safer patients, stronger businesses, and greater trust in modern healthcare.
A medical emergency usually looks kinetic: doctors rushing, alarms blaring, and doors flying open. But today, a hospital crisis often begins in total silence, in that exact moment when a single computer screen freezes. Healthcare data breaches cost an average of $7.42 million per incident. It is the highest financial toll of any industry, a trend that has persisted for 14 consecutive years. Cybercriminals prioritize medical centers because the life and death nature of the work provides a high-pressure environment for extortion. When every minute of downtime increases the risk to a patient, administrators have fewer options than a typical CEO. This chart from the Ponemon Institute tracks the physical toll of these attacks. Data shows that more than 1 in 5 healthcare organizations experience an increase in patient mortality following a cyber attack. The Ponemon research attributes these outcomes to a breakdown in standard care. Ransomware caused procedure or test delays at 64% of victim organizations and forced 65% of affected providers to divert ambulances to other facilities. The modern healthcare breach functions as an active clinical emergency. Modern medicine relies on electronic health records as a central nervous system. These digital files connect the pharmacy to the surgical suite, ensuring that every department shares the same vital information. When ransomware infects that network, it causes immediate operational blindness. In a matter of seconds, physicians lose access to patient histories, drug allergies, and the lab results required to make a diagnosis. High-tech medical staff are suddenly forced to chart complex treatments using pen and paper. This forced regression drastically slows the delivery of care and increases the risk of human error. That slowdown leads to ambulance diversions. During the 2024 ransomware attack on Ascension Health, emergency vehicles were blocked from hospital doors and rerouted to alternatives. For a patient suffering a stroke or severe trauma, survival depends on the golden hour, the critical 60 minutes after an injury. Rerouting an ambulance to a distant facility burns through that time, often leading to permanent complications or death. By severing the flow of digital information, hackers physically prevent a hospital from treating the life and death emergencies it was built to handle. The threat vector also moves down from the main network into the medical hardware directly connected to a patient's body. Hospitals utilize a growing fleet of internet-connected devices, many of which run on unsupported, decades-old operating systems like Windows XP that lack modern security patches. Connected infusion pumps can be controlled remotely to modify the dosage of drugs delivered into a patient's bloodstream. Hackers can exploit these flaws to maliciously alter medication levels without any physical access to the device. Even implantable technology is at risk. Security researchers identified 8,600 individual software flaws within pacemakers, including vulnerabilities that could allow for unauthorized tampering. This graphic details the architectural failure within the IoT trustworthiness framework. As shown in the red circled section, the collapse of data integrity and security protocols creates a vulnerability that bypasses standard hospital monitoring. Internet-connected devices provide a direct pathway for outside actors to manipulate the hardware sustaining a patient's life. Healthcare is migrating into the home. Telehealth platforms and remote monitoring are expanding the digital attack surface into unregulated residential environments, where security is rarely a priority. By 2026, security analysts expect attackers to target remote patient monitoring devices to manipulate data. By altering incoming blood pressure or glucose readings, a hacker could trigger an unnecessary medical intervention or mask a life-threatening symptom. As providers use AI assistants to manage clinical notes, they face the risk of prompt injection. Cybercriminals can embed hidden instructions in a patient's symptoms list, commanding the AI to ignore warning signs or export sensitive health records to a third-party server. The theft of medical data also carries a severe psychological toll. When hackers breached the Vestamo psychotherapy clinic in Finland, they blackmailed individual patients, demanding payments to keep their private therapy sessions from being published. This creates a psychological contagion. Fearing that their private history will be leaked, patients may intentionally withhold critical symptoms from their providers. This erosion of trust forces patients to trade their medical safety for digital privacy, leading to misdiagnoses and the loss of essential care. The average data breach is identified in 241 days. In healthcare, that stretches to 279 days, giving attackers 9 months to manipulate systems. Motives are also shifting. Breaches with an espionage element jumped to 16% in 2024 as nation-states target medical research. Attackers target this sector because it works. They exploit the ethical mandate to save lives, using patient safety as a lever to ensure their ransom demands are met. Just as physical hygiene prevents infection, digital hygiene serves the same purpose today. Securing a network is as critical to patient outcomes as scrubbing in. In the digital age, cybersecurity determines whether a hospital can fulfill its most basic promise: to do no harm.